I think clinically, every good clinician, I think no matter what their perspective, I think every good clinician has to pay attention, a lot of attention to the patient's subjectivity. It's a way of knowing the patient. It's a way of having empathy for the patient. And I personally believe that the best clinicians do that intuitively. I mean, of course, the psychodynamic theorists and clinicians write about it the most, but I think clinicians from many perspectives, when they're really effective, are paying attention to the patient's subjectivity. I think the therapist's subjectivity is a more complicated question. I think the therapist's subjectivity has to, in some way, be tailored or aligned with the patient's subjectivity. It's not like we can just come into the therapy with who we are and be the same way with everybody. I don't think that works. I think there has to be a good matching between the patient's and the therapist's subjectivity, but it has to start with the therapist trying to understand the patient's subjectivity. That has to begin there. And I think one of the things that I've always liked about the control mastery work is that the case formulation method, what we call the plan formulation method, gives you a very good window, I think, into the patient's subjectivity in a broad sense. That may change from session to session, of course, but it gives you an orientation to the patient's subjectivity that I think is very, very important. So I think clinically, this is a crucial topic, and I think, as I said, the most effective therapists are doing this all the time. From the research point of view, I think this has been one of the big failures of psychotherapy research, that the research has not paid enough attention to subjectivity, either from the patient's point of view or the therapist. We make many false assumptions in psychotherapy research, that if you're doing a study of treating depression in a clinical trial, that all depressed patients are the same. But of course, that's a ridiculous assumption, and it doesn't really, it gives a false sense of homogeneity between patients and treatments, and I think that that's been one of the big failings in research. I think it's a failing that can be corrected. I think if the research were geared more toward paying attention to who is this patient and how is this patient's subjectivity going to play out in the therapy, how could we evaluate that, how could we assess that, and how can we assess the degree to which the therapist is attending to that subjectivity, that would give us much more precise kind of data, both from a process point of view, but I think also from an outcome perspective. So I think that's one of the directions that I think research needs to go, and that's not just qualitative research. I think that that kind of work can be done in a very rigorous quantitative way, and I think that would enrich the research a great deal, and I think it would create a much bigger bridge between clinicians and researchers. So.